And as more coronavirus testing sites pop up throughout the state, what are your options and how can you be sure of the results? Also, how much is it going to cost you? Our 2 Works for You's Vincent Hill is working to get some answers for you.
2 drive-up locations here in Tulsa, 2 very different test types, both promising results of COVID-19. This may look like a banking drive-up window because it once was. Now, Cura Telehealth uses it for coronavirus testing. Instead of deposit slips coming through the tunnel, it's a self-administered finger stick blood test.
One variety, which is an antibody test that looks for whether a patient that's had coronavirus infection or is in the midst of the infection, showing an antibody response.
Dr. Beard says within 15 minutes, a patient will know if their body is reacting to the virus. The cost, only $60 with their doctor's recommendation. If you don't have a doctor, Cura can provide the screening for an additional $60. As for a positive result,
that means they have had the virus most likely, and they've mounted an antibody response to it. But there is the possibility for a couple other viruses that can cross-react.
Beard says if a patient wants a definite answer, they should do a nose swab test at a cost of $250. That's a total of $370. Colleen Neighbors of MCI Diagnostic says her lab only does the nose swab because it's the most reliable and the only FDA-approved test. At MCI, you can bypass a crucial requirement.
You don't need a doctor's trip to come here. You're paying for your test. It's your life. We're in a pandemic.
Neighbors says the majority of lab tests do not require a doctor's note, and COVID is considered a lab test. Last week, her lab installed equipment allowing them to test in-house, providing results within 72 hours.
This is a DNA extraction test. It is not a finger stick, nor is it a 15-minute test.
For those who don't have insurance, Cura may have an option.
We have tests that we can give out for free. We're holding back 100 tests right now, and we're going to regulate it as we go along, that we would give for free. And of course, those are only the local patients that can get here.
And those free tests are only for those who pass a screening with Cura. In Tulsa, Vincent Hill, 2 Works for You.
Now, the Tulsa Health Department says that most of the healthcare systems use private or commercial labs. A consultation with a medical professional is always advised. The health department is also offering drive-through testing for high-risk individuals who are under or uninsured, and it's by appointment only.